face of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Than when I started.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show, living a longer and healthier life. We're going to talk a lot about the medicine of podiatry, or I should say, doctor of podiatric medicine, with Dr. Jerry Perlmutter here today. So it's going to be an action-packed program about the foot. I'm going to be honest with you right there. So without further ado, I want to welcome Dr. Perlmutter to the program. Thank you for joining us this evening.
I appreciate the opportunity to try and give some knowledge to some of the patients who have some foot problems.
This will be great because we haven't had a DPM on, and it's been a while. So I wanted to have you on, and thank you again for joining us on this adventure of health. Let's get right into it. Let's talk a little bit about your education and background and what goes into being, I guess, a DPM is a doctor of podiatric medicine. Did I get that
medicine,
right?
Yes, podiatric medicine.
Podiatric medicine. I'm going to get it right now.
So what happens, you go to 4 years of college, undergraduate, and then you apply to podiatry school. And it's basically medical school now. It's 4 years. The first 2 years, they interact with medical students, and the last 2 years, it's all strictly lower extremity. Then, when they graduate from podiatry school, they go to do your 3-year residency.
Okay.
And everybody does a 3-year residency now. A long time ago when I started, they weren't all 3-year residencies, and they are now all surgical. So not only do they get podiatric medicine, but they do foot and ankle surgery.
So a lot's changed since you went to
when I did my
school.
residency, the stuff that they're doing now wasn't invented.
Oh,
wow. That's how much involved it's gotten. I mean, there's all kinds of internal fixation, which we can talk about later. There's just stuff that the most common bunion that we do now was not developed when I graduated.
Yeah, and there's a lot of different medical technologies nowadays. We see that across all fields, though. I mean, I have heart surgeons on here, and they always tell me, David, you know, like the open heart surgery, we don't do that anymore. We go under the rib right here. Now, how is that possible? But we'll get into those medical technologies. Let's talk a little bit about routine and palliative podiatric care.
Okay. A vast majority of podiatry treat all ranges, from pediatrics to the very geriatric. And a lot of my practice, and everybody's different, I treat people, we'll talk about the diabetics in a minute, that just really come in for palliative care on a regular basis so they don't have a problem. They have fungus toenails, which is very common as you get older. They have corns and calluses. They have bunions that they don't want to do surgery on. So you just keep them comfortable, and they come in on a regular basis depending upon what their problem is. And we just keep them comfortable. If they have a problem, we take care of it. But a significant amount of my practice is just basically cutting corns, calluses, and nails. And once again, just to keep people comfortable. It's a lot different down here than up north where I originally practiced, because you can wear open-toe shoes down here almost all the time. So the bunions and the hammertoes that would be a real big problem in the winter up in New York where I grew up is not here because they can wear more sensible shoes.
Oh, where did you practice in New York? Obviously, we're here. We're sitting in a studio in Boca Raton here,
right.
So we have a lot of New York listeners.
I did a residency in the Topeka, Kansas VA. Okay, I was the first resident there. They just opened up. I was the first resident. I came back. It was a one-year program, and it was half surgical, half medical. I happened to go to the New York Podiatry College, actually looking to see if anybody was wanting a podiatrist to help them out. And as I was sitting there talking to some of my professors, a woman called up. Her husband had had a very bad automobile accident, who had a practice in the Bronx and was looking for someone to work. So it was just pure luck. So I went up to visit him. He was in body casting. It's really not funny, but it was. And I worked there for a year and a half. In 1981, I bought a practice down in Margate, Florida, and I've been practicing since then.
And you're still in Margate today?
Yes, I'm not in the same location. I'm right across the street from Northwest Medical Center.
That's a great community. My wife and I, our uncle Bill and Aunt Allison live in Margate. Love it.
Yeah, it's a nice place. It's a nice place.
I can
to
see
grow
why
up.
you didn't leave, because it's a great community.
Yes.
It really is.
It is.
You don't hear too much about it, but it's still close to everything. I mean, it probably wasn't even too bad of a drive right here to get over here.
No, I mean, just get to understand something. When I moved down here, there were maybe 5 podiatrists in all of Northwest Broward. There are 5 podiatrists that I can almost see out of my window now. But there are a lot more people also.
Yeah, how it's changed. And tell me a little bit about Topeka, Kansas, because you're from New York and you do your training out in Topeka, Kansas at a VA hospital. That must have blown your mind a little bit.
It was a great year. I mean, it was 1980. You didn't have to lock your door. They are the most friendly people in the world. If I wanted to live in the Midwest, I probably could have made a small fortune, but I grew up in New York and I went back. It was wonderful. I mean, the people were really nice. It was very hot during the summer, freezing cold during the winter. But I wouldn't trade it for anything. I actually met my first wife out there, and she came back with me to New York.
That's interesting. I always like to ask that question.
Yeah, but see,
because
the difference now, it's a 1-year residency. Now I'm saying they do a 3-year surgical residency. So the training is remarkably better.
Yeah, a lot has changed, as we said. We're here with Dr. Jerry Perlmutter, and he's a DPM, Doctor of Podiatric Medicine. He corrected me there. I'm used to saying podiatry.
It's podiatric.
Podiatric. I got it wrong twice.
That's okay.
One more, I'm out of here, and you take over the show.
Yes, no problem.
No, his number is 954-974-0494.
Correct.
It's located in Margate, Florida, which is in Broward County, 5800 Colonial Drive, Margate. Not a far drive from Palm Beach County, but we're on across South Florida here, so you know where to find us. Let's talk a little bit about some of the more common ailments with the foot you treat. You mentioned a lot with nails, and one of the things I wanted to ask about is bunions, because it's something that I've talked about on the show before, and I've heard that, you know, with women who wear a lot of high heel shoes, that can maybe cause bunions, but maybe even bunions can be genetic. They can happen to men as well. I want to get your take on bunion and bunion care.
One more thing about fungus toenails, okay? Because
oh, sure.
They're very, very difficult to get rid of. Okay, there are oral medications, which myself personally don't believe it solves anything. There are topical medicines which help, and some doctors use laser, but it's a very expensive toy, and they will not guarantee that it works. But when someone says they can cure fungus nails, God bless them.
And that's something that is a discoloration on the nail, but can it also be tender or painful at all? Or
if it's left alone, it can get painful from shoes. It can get ingrown. It can get infected because it's not a normal growing nail. I mean, if you look down at your foot and you have yellow, thickened, colored nails, discolored nails, so that's what you have.
And you said not necessarily oral, but topical or laser may be better?
I don't do laser. There are some doctors that do, and they say it works, and maybe it does, maybe it doesn't.
You do topical?
Yes, I do. I do prescribe pills, but I tell the patient it's not going to cure you. It may get rid of it, but then you have to use topical medicines the rest of your life.
Okay, yeah. So definitely. Now, let's get in a little bit into bunions, because is that something that can come from genetics, or something that's caused by the way we walk, what we wear? Unless
you get it, probably by the age of 10, it's not hereditary. What usually causes bunions, and the biggest misconception, is shoes. Okay, because most women wear high heels, and not every woman gets a bunion. It's usually caused from flat feet, or the technical term is pronation, which means when you stand, your foot goes to the inside, so you're basically spinning off your big toe. Okay? My office manager, who's sitting out there, I did her bunions at 14, which is very, very young.
Oh, wow.
But there are people that live with it. I mean, I have people that come in at 70, 80, 90 years old. They just never did anything about it because it didn't bother them enough to do bunion surgery. There are basically 3 things you can do for bunions. You can change your shoe wear. You can try and shield it with different things which won't change the bunion, or you do surgery. And there are different bunions procedures for how old you are. You don't do the same procedure on a 20-year-old that you would do on a 70-year-old.
Exactly.
There's also, like I said, the advances that we have now are mind-boggling compared to what I did 30 years ago. I mean, I laugh at what we used to do 30 years ago, and that was state of the art. They now have different procedures depending upon the severity. And you can do something where the bunion is itself, or you can actually go further back on the foot and correct it back there. So no one has to do a bunion, but what I tell my patients, if it affects your lifestyle, you should think about doing it.
Okay.
And nowadays, bunions are done outpatient. I cannot tell you the last time I did a surgery where I kept the patient in the hospital. 30 years ago when I practiced, I don't think we did a bunion outpatient.
Wow, that's really changed.
I mean, they used to stay in the hospital 2 or 3 days afterwards.
Unbelievable. So now they're literally, in some cases, walking out?
You go in the morning, you do the surgery, it's an hour surgery, hour and a half, depending on how complicated it is, and you go home the same day. Now, you got to stay off your feet for 3 to 5 days because it hurts, and depending upon the procedure, you're either in a surgical shoe or a walking boot, depending upon how complicated the bunion is.
Okay,
But I tell people, you know, if you do the surgery, figure 3 to 5 days you're going to be on pain pills, and then you start walking to your tolerance.
Okay, nice. Now, this is a term I don't know much about, hammertoe. I've heard of it, but is that's in the same kind of area as the big toe bunion, or
no?
different?
Hammertoes are basically crooked
okay.
second, third, fourth, and fifth toes. Okay. Once again, it's something that develops over time. Very few people are born with hammertoes. I mean, occasionally you get a kid or someone that comes in with a congenital problem from birth where the fifth toe goes over, but most of the time it's a slow developing problem. And it's also from the way you walk and stand. Let me just go back for a second because I can intertwine both.
Definitely.
You can try and slow down the process of getting bunions and hammertoes, and we can discuss orthotics in another minute, what that's for. We're giving a pair of custom-made arch supports or orthotics. What that does is make you walk more functionally normal. So if someone comes in and they don't want to do the surgery, but they're young, you try and get them into the orthotics so the bunion doesn't proceed, because if you don't, it's going to get worse. And the hammertoes is the same thing. They're just basically crooked toes that rub up against the shoe and get irritated and cause corns and calluses. Once again, down here, people are fortunate because most of the time you can wear open-toe shoes. Up north, when I treated people, during the winter, people had way more problems.
Oh, yeah. You definitely can't wear open-toe shoes.
Not when it's snowing out.
Especially the winters they have up there.
Not when it's snowing out.
Definitely. We're here with Dr. Jerry Perlmutter. He is Doctor of Podiatric Medicine. I got it the third time. I knew I was going to get it. I wasn't going to let you down. Board certified.
Foot and ankle surgery.
That's great to hear. His office at 5800 Colonial Drive in Margate, 954-974-0494. And tell everyone where you're on staff at, what hospital you're on staff at.
My office is right across the street from Northwest Medical Center, so that's where I go now. I used to be on Carl Springs, but as I've become more mature and trying to simplify my life, I used to have 2 offices also. I closed one down in Pompano a few years ago. I just have the one practice right across the street from the hospital where I don't do elective surgery there. I do the inpatients, and we can discuss that, hospitalization, everything else. Most of my surgery is done at Park Creek Surgical Center, which is a wonderful facility about 10 minutes down the road. And almost everything can be done outpatient now.
That's fantastic.
I mean, we do bunions, hammertoes. We can go into some other stuff we do also, on the other side of the break if you want to.
Yeah.
But almost everything can be done either outpatient at a hospital or outpatient at a surgical center. I just prefer surgical center because all they do is not podiatric. All they do is elective surgery.
That's great to hear. Now we're here with Dr. Jerry Perlmutter. We're going to take a quick break, and on the other side, we're going to talk a little bit about plantar fasciitis, the diabetic foot, and other foot ailments on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back on the You and Your Doctor show with Dr. Jerry Perlmutter. He's a DPM, which we learned is a doctor of podiatric medicine.
2 for 2.
2 for 2. And he's board certified in foot and ankle surgery, you just told me. 5800 Colonial Drive, Margate, Florida, 954-974-0494. A great podiatrist here and foot and ankle surgeon. We're getting a ton of info, so thank you again for joining us.
You're welcome. Thank you for having me.
Let's get into a little bit. I know you're not treating as much ankle and fracture care as you did, but tell us a little bit about what you're treating today.
Okay, let's talk about the ankle because the residents now are fully trained in ankle and leg trauma surgery. They work with orthopedists now, and they work with other podiatrists that are, better trained than I am in that. I don't do foot and ankle surgery anymore. I got to a certain point where it's not what I want to do. I want to sleep at night. I don't want to be married to a patient for the rest of my life. But there are plenty of podiatrists in my area and in Palm Beach that do that. And most people that get trained in 3 years can do that surgery as well as anybody in the world. So I do not do that, but there are plenty of podiatrists, if God forbid you need it, that do. And we're now on call in the ER, and we get called in just as much as the orthopedists do. So like I said, I don't do it. When someone comes in, and most of the time it's in the ER, I refer them to the guys that I would want my ankle to be done by.
You have the great info and knowledge. You've been in, you said, down here for 30 years, just
Yes.
down here.
Right.
So that's you're a great resource. Now, plantar fasciitis, did I get that right?
Yes, you did.
That's been it seems like every time I'm searching something about the foot, that comes up. Why is that so common knowledge, and why are we seeing so much of?
It's a combination of, it's called a heel spur syndrome, plantar fasciitis, because you can have the largest spur on the bottom of your heel and still have no pain. I've had heel pain since my 3rd year in podiatry school, and I still don't have a spur. There are 2 reasons that you get heel pain, and I'll combine it all together. I have a high arch foot or a cavus foot type, and when I stand, I walk on my heel and the front part of my foot. I don't pronate, okay? My pain is when I stand. I've been wearing custom-made orthotics since my 3rd year in podiatry school, and I can't function without them. And even at my ripe old age, I still play basketball and tennis, not nearly as well as I'd like to, but I still play. So part of the reason, and it's a smaller part, is a high arch foot. The biggest problem, or most common problem, and I see probably 200 people a year with heel pain, new patients, is people that have flat feet that excessively flatten or pronate. And what happens is that the muscle on the bottom of the foot that you can feel is called the plantar fascia. So it's called plantar fasciitis. The pronation, or the flattening of the arch, pulls on the calcaneus, or the heel bone. And actually what it spurs is basically calcification of dried blood, micro bleeding. But it has nothing to do and does not correlate with your heel pain. So it's caused by excessive pronation or flat feet. I have a standard protocol. We take x-rays because you have to take x-rays. You explain to the patient it doesn't matter how big your spur is, but it's due the way you walk and stand. And I do a very, depending upon what I have to, brief or more involved orthopedic examination. My protocol, and I don't know about anybody else, is I ask the patient, is it painful enough for an injection? Okay, if they want an injection, I said, if you want to get out of the pain right away, we give you the shot. People walk in beforehand almost always know whether they want it or not. The pain, acute pain, you give an injection because you can get them out of the pain immediately with local anesthetic and a cortisone. What I do after that is make them a removable arch pad so they can take it on and off. Most people wake up in the morning, and the technical term, which really doesn't make a difference, is called post-static dyskinesia. It means it hurts like heck when you wake up in the morning and start walking. So I make them this pad that they can take on and off, and usually if they have pain in that, I actually let them sleep in it. And I also show them stretching exercises. That's the most conservative. The next thing, if they want the shot or not, we talk about a custom-made orthotic or an arch support. One is over-the-counter, it's made for a shoe size. The other one is made specifically, you make a cast and do that. That's long-term relief. All right, that's like what I have in my shoes, I told you, since my 3rd year in podiatry school. If I do 2 surgeries a year, That's a lot for heel pain. And what you do, a long time ago, we used to grind down the spur. It was barbaric when you talk about it now, because now you don't even do it. There are all different types of procedures. You can do it through a small incision in the heel, and you can actually visualize it like it's arthroscopic. I tend to do it. I cut the plantar fascia near the big bone, near the bunion joint. And you cut the muscle, and the pain goes away. But injections are for the acute pain. Arch supports are for the chronic and long-term pain, not to get, so people don't need surgery. So that is probably, besides some corns and calluses and nails, the most common thing I see. It can happen at any age, okay? Why it happens when you're 65 and not 55 or 75, it just happens. It's like the straw that breaks the camel's back. So that is my protocol. I do not differentiate from it. If people don't want the arch support of the injections, I tell them I can't help them. Physical therapy can help. It doesn't cure. Anti-inflammatories like Motrin or Advil or anything also can help, but the second you stop it, you need to get rid of the cause, which is the flattening of the arch.
Okay.
And orthotics work, like I said, I can see 200 people and maybe do 2 surgeries.
I was going to ask you about orthotics, so I'm glad you brought that up. Now, that surgery, that if you do have to do it, that's minimally invasive, it sounds like, right? It's very...
Yeah, I make maybe an inch incision. The people that do it through the arthroscopic make an incision on one side, actually make an incision on the other side, put a camera in so you can see the plantar fascia, and you snip it.
Okay.
So in either case, you're snipping the plantar fascia. It's just how you want to do it.
But most cases that you deal with, you can manage with other care besides surgery.
I do very little surgery on heels.
We like to hear that.
Yes. But I sell a ton of arch supports.
Hey, that's fine. I'd much rather have an arch support than a surgery. And surgery kind of is the last, And so
the problem with the surgery is it hurts afterwards, and you got to be very careful for 3 weeks the way I do it, because I make an incision on the plantar aspect. So you don't want the incision to open up.
We've had a lot of heart surgeons on this show, endocrinologists. I'm kind of changing gears here. I want to talk a little bit about the diabetic foot as well, because I didn't know much about it until a few years ago and started doing this show, that, the foot and diabetes go hand in hand.
Diabetes is a systemic problem. Affects your eyes, every body organ. The problem with feet is you can get what's called diabetic peripheral neuropathy, which is depending upon whether it can be numbness and tingling, it can be pain, or it can be complete loss of sensation of the foot. People walk into my office literally with ulcers, which is an opening of the skin, which if a normal, quote-unquote, non-diabetic would be in agony, they don't even know they have it. And that's the problem with diabetics. The second major problem with diabetics is the circulation. A lot of times they have horrible circulation, and for some reason, people that you think are sane and normal do not control their diabetes. We just put a patient in the hospital. A normal blood sugar is 110. She had 357.
Whoa.
All right? Yeah. And this is someone that I thought controlled herself. The biggest problem with diabetics is ulcers and infections, because they don't know what the heck's going on. There are times, unfortunately, we just did 2 cases last week where I had to take off part of the foot because it was past the point of helping. Something called osteomyelitis is an infection of the bone. And once it gets to that point, you basically have to remove that body part. And then what you do is you put people in a custom-made arch support with a diabetic shoe. But you can treat diabetics for everything, but the biggest problem is plantar ulcerations or even on the top of the foot. And it's very difficult to heal because A, they don't have sensation, and B, most of the time they have really bad circulation. Just one quick thing on circulation.
Definitely.
Now they have, and I don't know if you had anybody on the show, endovascular surgeons, which don't open up the whole leg. They actually like little puncture marks and basically do like a roto-rooter job. We have 2 or 3 doctors in my area that are unbelievable. 10 years ago, the people would have lost their legs. Now they don't. So that's a major, major improvement. And when I tell my diabetics with poor circulation, you don't get the blood down there, I can be the best podiatrist in the world, I can't cure you.
Yeah, we do have from Palm Beach County on this program every once in a while Dr. Joseph Fricata. He's a vascular surgeon, and I know you have yours down in Broward County as well. But yeah, he does a lot of limb salvage, so I'm glad you mentioned that. You're a wealth of info, and I think that's most important in health. I mean, nowadays people are Googling, talking to people, but if you have a great team, I mean...
We send a lot of people out, okay?
Nice.
And unfortunately, I have a bunch of patients because I have an older population that I have to put in the hospital. The reason I tell patients that they need to go in there, and it's only at a certain point, is when I don't think oral antibiotics will work, They need to go on intravenous antibiotics. Also, when you do a culture in the hospital, in 3 days, you can get the results back, as opposed to 5, 7, 10 days in the office, and you're not guessing, okay? The IV antibiotics cover everything, and then they can hone them off onto oral antibiotics. So as much as I hate putting people in the hospital, there are times I say, you want to have lunch before you go to the hospital, or you want to have lunch at the hospital.
Yeah.
That's how bad a problem it is.
I think important, though, it's great to have a physician who can put you on the right path. We're here with Dr. Jerry Perlmutter. He is a doctor of podiatric medicine.
4
4
for 4.
for 4, thank you. 5800 Colonial Drive, Margate, Florida, right here in Broward County, 954-974-0494. Hard to believe, but we only have 2 minutes left, and
Do you have a specific question? Because I want to talk about one other thing, unless you want to.
You go.
Okay. There's something called a neuroma, which is fairly
That's
common.
what I was going to ask you, because I skipped over
Son
it.
of a gun.
You go.
A neuroma is an enlargement and inflammation of the nerve that runs in between the toes. It usually occurs between the second and third and fourth. When you take an X-ray, you don't see a neuroma because it's soft tissue. Now, can you do an MRI? Yes. I usually don't, because a neuroma is a symptom like, it's like the gout. It looks like, tastes like, and smells like. When someone walks in with the gout, you know it's the gout.
My Uncle Jack has it. I know about it.
And there are medicines for that, and we can treat the acute attack in the office, and then I send them to a doctor. But neuromas can be treated conservatively with injections of cortisone and local anesthetic. And if that doesn't work, honestly, you basically have to live with the pain or do surgery. And in surgery, actually, you make an incision. Although the neuroma is on the bottom of the foot, you make an incision on the top of the foot, because then they can weight bear. And well, I tell people, when it gets to the point where it bothers you, and what happens is you get pain on the bottom of the foot, and then usually get shooting pain into the toes. It's a symptoms-based diagnosis. Let me say something quick about gout, because a lot of people come in with gout. It can be excruciatingly painful. People literally walk in without shoes on. I treat the acute attack. I give them an injection to numb it up, and they give them a cortisone shot, and depending upon what they can take, there are 2 or 3 or 4 different medicines. I do not treat, and podiatrists shouldn't treat, the chronic condition. Then we send them to the primary doctor for oral medicine.
Fantastic. It's hard to believe we ripped through 30 minutes, but I got to ask you to come back on the program sometime. You're a wealth of info.
Whenever you want me, I will be more than happy to. Okay?
That's Dr. Jerry Perlmutter, once again, doctor of podiatric medicine, 5 for 5, board certified foot and ankle surgeon, 5800 Colonial Drive, Margate, Florida, 954-974-0494. Check him out. Go see him for all your foot and ankle ailments. Thank you for listening.
Thank you for having me.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its